Hello, everyone. How is everyone doing? Hopefully, staying safe during this COVID 19 pandemic that's going on. Pandemics have been going on for a very long time, probably from the start of the history. We have overcome the pandemics before, and I know that we are going to win over coronavirus as well. There was another well known pandemic. According to Phillips, this pandemic was known as the White Plague, and the name was given so because it left its infected individuals with a white, pale skin tone. Today, the disease is known as tuberculosis, also known as TB. Although TB was around for many years, Dutta says it was in 1819 when a French physician identified that TB primarily attacked the respiratory system. That being said, it also attacks other organs. Moving a few years forward, according to the CDC, on March 24th, 1882, Dr. Robert Koch announced the discovery of Mycobacterium tuberculosis, which is the bacteria that causes TB. This was a very important and huge discovery because in order to find the cure, you first must find the cause. When Dr. Koch discovered the bacteria behind TB, TB was at its highest point in the USA. This was due to the rise of AIDS epidemic in the early 1980s, according to Egan's. As we all know it, AIDS depresses our immune system. This gave an opportunity for TB to grow faster and stronger. TB is an inhaled airborne droplet. If the infected individual doesn't know that he or she is infected, then the person not only harms themselves, but also those who they hang out with, their social groups. For this reason, this disease is very deadly. According to Egan's, most of the time TB is contained, meaning it's controlled by our body's immune system and is asymptomatic. That being said, the disease can reactivate anytime. Reactivation can occur within months to years to develop, usually occurring when the immune system is declining. According to Egan's, 90% of the cases reactivate. This is due to the slow growing nature of the bacteria. It is difficult for our bodies to detect the bacteria until it's too late. In primary tuberculosis, symptoms shortly appear after the exposure. The most common symptom is a fever, which can stay for 14 to 21 days. There are other symptoms which are commonly associated with other diseases. For this reason, it is difficult to diagnose TB given the infrequency of cough and pulmonary infiltrates, according to Egan's. Discovery of diagnostic methods was first discovered in 1907 through 1908. PPD test, also known as Mantoux test, was developed. This skin test contained extracts of the tuberculosis bacteria, which is injected under the skin, and the body's reaction is measured. A positive test result means positive for TB. That being said, sometimes there are false positives. According to Egan's, false positives are due to prior BCG vaccine or infection with NTM species, also known as non tuberculous mycobacteria. BCG vaccine is a vaccine against TB. According to vaccines.com, I apologize, according to vaccines.org, A vaccine is made from a very small amount of weak or dead germs that can cause disease, for example, viruses, bacteria, or toxins. Vaccines are meant to prepare our bodies to fight the infection by creating antibodies. Along with PPD testing, Egan's denotes the gold standard for diagnosing tuberculosis from pulmonary and extrapulmonary sites is culture isolation of the organism on solid or liquid media. The downside of the culturing is that it takes a very long time, about 4 to 6 weeks. First line of defense in treating TB consists of four drugs: isoniazid, rifampin, piazinamide, and ethambol. These drugs are antibiotics made especially for TB patients. If a drug resistance TB is acquired by a patient, then a different course of therapy is taken. Patients who who acquire the disease must be reported to the local public health immediately, so everyone in recent contacts can be detected and be tested for. According to Egan's, sputum production increases as the infection progresses. Since increased sputum production is common with the progression of the disease, we must use airway clearance techniques. Most of the time, RTs take this role. RTs help with chest physiotherapy, such as percussions, post drainage, high frequency chest wall oscillation, also known as VEST, and other cough assist techniques. Individuals can help prevent this disease by constantly washing their hands. Hand hygiene is the number one preventive way for any and all diseases. Individual can also get vaccinated for influenza, pneumococcal, and Tdap. According to Egan's, when dealing with TB patients, healthcare workers must wear N95 masks or higher, or even respirators, since TB is a airborne disease. We have had pandemics before. They have come and left, and tuberculosis is not different. On March 24th, 1882, Dr. Koch announced the discovery of Mycobacterium tuberculosis, the bacteria that causes TB. According to CDC, a century later this day, March 24th, is recognized for World TB Day. We don't celebrate the day because the disease is not eradicated, but this day is for education. Purpose is to teach each and every one about the dangerous disease and how to stop the disease from spreading. According to Datta, with the improvement in diagnostic procedures, therapeutic interventions, and preventive strategies, the World Health Organization, also known as WHO, has committed to eradicate tuberculosis by the year 2050. I look forward to that day when the silent killer is eliminated and we can celebrate March 24th as World TB Day, a disease that is history. Thank you.